Bismillahirrahmanirrahim. In this video, we are going to discuss the physiology of calcium homeostasis and two hormones involved in it. First is the parathyroid hormone, and second is calcitonin. Although we do have other factors which are involved in calcium regulation, such as vitamin D, the estrogens, and fibroblast growth factor, but in this video, we will discuss the parathyroid hormone and calcitonin only. So let's start with the parathyroid hormone. It is a hormone released by the parathyroid glands, the chief cells of parathyroid glands. Parathyroid glands are basically four small glands present on the posterior surface of thyroid gland. So what is the function of parathyroid hormone? It tries to increase the calcium inside the blood. So by all means, it is going to increase the calcium. It basically acts on three sides, or some of the effects are done directly by parathyroid hormone and other effects are done indirectly, because parathyroid hormone activates vitamin D. Basically, vitamin D is converted into its active form, which is 125 dihydroxyvitamin D, and parathyroid hormone has a role in converting vitamin D into its metabolites, or you can say in converting vitamin D into its active form. So let's have a look on the three sites where parathyroid hormone is acting. As you can see in this diagram, first is the kidneys, and in the kidneys, parathyroid hormone also regulates the vitamin D. So vitamin D has effects on the bone resorption, and vitamin D has effects on GIT. Although parathyroid hormone itself also has effect on the bone resorption. So in total, there are three sites: the kidneys, the bone, and the GIT. And on all three sides, the prime target will be to increase serum calcium. So the role of parathyroid hormone and kidneys is to increase the reabsorption of calcium, or you can say decrease the excretion of calcium. The role of parathyroid hormone in bone is the bone resorption, so that more calcium and phosphate can be added into the blood. And in intestines, it increases the absorption of calcium and phosphate. So right, increasing the absorption of calcium and phosphate, increasing the amount of calcium and phosphate in the blood. But in kidneys, although the calcium role is same, it increases the absorption of calcium, which leads to increased calcium inside the blood. But the phosphate is excreted, so the reabsorption of phosphate is decreased. And now you have to understand an ultimate effect, because two of the factors are trying to increase the phosphate in the blood and one of the factor is trying to decrease the phosphate. So the ultimate role is that this effect is so dominant that phosphate ultimately decreases in blood. So what parathyroid hormone does is ultimately it increases the serum calcium and it decreases serum phosphate. All right. An interesting point is that calcium the calcium is increased inside the urine by parathyroid hormone. Now that is a very interesting point, although it's not that important for boards, but I'm just telling you for an interest point of view. What basically happens is that because of the increased resorption and increased absorption from intestines, the calcium inside the blood is increased so immensely, such a high level of calcium, that despite trying to reabsorb more calcium, still there is a larger amount of calcium left inside the urine. So a person with no parathyroid hormone will have a low blood calcium and a very low calcium inside the urine. But increased parathyroid hormone activity will lead to increased serum calcium and to some extent calciuria, or you can say increased calcium in the urine. And the role of phosphate is clear. All right. Now let us have a look on this. But before that, let me tell you how parathyroid hormone act on the bones. So basically, we have two kind of cells. Let me draw a bone. So just consider this as a bone, and there are some cells which have a role in. I'm sorry for this. There are some cells which increase the mineralization of bones. They are called as the osteoblast, and there are other cells which are involved in the demineralization or resorption of bone. They are called as osteoclast. So what basically happens is that parathyroid hormone activates the osteoblast. This must be surprising for you. Parathyroid hormone activates the osteoblast. So osteoblast tries to increase the mineralization of bone, but osteoblast also release rank L. So there is release of rank L from these osteoblasts. And what is this rank L going to do? This rank L ultimately activates the osteoclast. So parathyroid hormone do not activate the osteoclast directly. The direct effect of parathyroid hormone is on the osteoblast. Those osteoblasts activate osteoclast, and the ultimate result is that the activity of osteoclast dominates, and we say that parathyroid hormone leads to the resorption of bone, a net resorption of bone, although it is directly affecting the osteoblasts. So this was the role of parathyroid hormone on bone. Now let's have a look on the theory. As you can see, they simply say parathyroid hormone increases the calcium inside the blood. This is the primary function. It increases the absorption of calcium from the GIT, and so it increases the bone resorption, increases the calcium absorption, decreases phosphate absorption, and increases the conversion of vitamin D into its active metabolites. And then there is the concept of rank L, which I have already mentioned. Parathyroid hormone is also called as phosphate trashing hormone. These are simple points. In regulation, there is again a repetition of all of these points. Just a different point to mention is that parathyroid hormone tries to decrease serum magnesium. And if there is a very low amount of parathyroid hormone, that decreases more serum calcium. So this is an interesting point, but not very high yield for your board. Now, what regulates the secretion of parathyroid hormone? The primary regulator for parathyroid hormone is calcium. So the primary goal of parathyroid hormone was to increase serum calcium. And so whenever there will be low calcium, that will lead to release of parathyroid hormone. And when there is high calcium, that will decrease the release of parathyroid hormone. Another regulator for parathyroid hormone, although that has a secondary role, but still it is a regulator, is the active form of vitamin D. Since parathyroid hormone is involved in activating vitamin D, so if there are active metabolites of vitamin D in the blood, they will inhibit parathyroid hormone. This was all about the parathyroid hormone. Now there is a brief overview of the calcium homeostasis. They are mentioning that calcium is found in three states. It is found in the bound form and with anions, and 45% of calcium is found in the ionized and free form. When we regulate calcium, we are basically concerned with this ionized or free form. So parathyroid hormone is also increasing this ionized calcium, and we basically talk about this ionized calcium. Now, what is the effect of pH? When there is increased pH, which means less amount of hydrogens, which means alkalinity, or you can say basic, what happens is there is decreased hydrogen. So albumin has nothing else to bind with. Albumin says there's no hydrogen, so what if I bind calcium with more affinity? So albumin binds calcium with an increased affinity, and so the calcium is found more in the bound form, and ionized calcium or free calcium is decreased. So less hydrogen means less ionized calcium, and more hydrogen in acidity, or you can say decreased pH. More hydrogen means more ionized calcium, and of course ionized calcium regulates the parathyroid hormone. So these were simple concepts, not very difficult. Coming towards the calcitonin, calcitonin is released by the parafollicular C cells of thyroid, and somewhat it has opposite effects of parathyroid hormone. Parathyroid hormone was having a primary goal of increasing calcium inside the blood, and calcitonin tries to decrease calcium inside the blood. Calcitonin decreases bone resorption, so it basically tries to keep calcium inside the bone. So it has a role in strengthening the bone, but remember that the main regulator is not calcitonin. The main regulator of free ionized calcium in blood is parathyroid hormone. Calcitonin has a very small role in regulating the calcium. This was all about the calcium regulation. In the next video, we will discuss glucagon, insulin, and somewhat the glucose regulation. I hope you enjoyed the video.